Dan Stunkard walks with an uncertain step. His left hand doesn't work, and he's never sure how high he can lift his left arm.
That's about the highest I can go.
But he has a clear understanding of why his body changed following a traumatic brain injury and what may or may not be possible in recovery. It's a clarity that has eluded most TBI patients until now. In August of 2010, Stunkard was in an ATV accident north of Pittsburgh. He wasn't wearing a helmet when he was thrown off the vehicle.
I had to be brought back 2 or 3 times before I even got put in a helicopter, life flight.
He awoke from a coma 3 weeks later, paralyzed in his left leg, arm, and hand. He questioned his future.
I didn't know whether I was going to be able to ever work again or anything. Hold my kids.
He soon got answers from an experimental MRI-based test under development at the University of Pittsburgh Medical Center. It paints a picture of the brain using high-definition fiber tracking. The imaging and analysis differentiate and bundle the various brain fibers responsible for different parts of the body. In TBI cases, this test shows if specific fibers are broken or missing and can quantify how many. That gives neurosurgeons like Stunkard's a much better understanding of brain injury and its long-term effects.
This was something that finally, at last, was a technology powerful enough with a sufficient degree of resolution to show us exactly what has happened to the white matter or the connection parts of the brain.
With standard MRI predicting TBI recovery from a mild concussion or a coma-inducing blow was a guessing game. It frustrated Professor Walter Schneider, who developed the technology, which is in its initial testing.
It's unacceptable to tell somebody there's something wrong in your brain, there's some swelling, and you will never work again in your life. We want a much more detailed diagnosis.
In Stunkard's case, high-def fiber tracking showed significant damage to the parts of his brain seen in yellow that control his left, initially paralyzed limbs. A portion of fibers are missing when compared to the uninjured opposite side that controls the right limbs, seen in green.
The fibers that control my hand were 97% missing, and the ones that controlled my leg were 67% missing.
Okonkwo predicted Stunkard wouldn't regain use of his left hand, but could, with therapy, walk again. That's exactly what happened. Okonkwo and Schneider say high-def fiber tracking can help tailor rehab to speed recovery, but also manage expectations.
I just kept thinking, 97% gone, I'm not going to get it back.
They're working with the Walter Reed National Military Medical Center, who will soon scan soldiers with TBIs. In as little as 3 years, Schneider says high-def fiber tracking could be more common for kids who fall on the playground, athletes on the field, or anyone needing answers after accidents. Tim McGuire, The Associated Press.